Recognize the gentlelady of Florida, Ms. Cammack, for her 5 minutes.
I appreciate it. Thank you, Mr. Chairman, and thank you to our witnesses. I know it has been a long day. Our apologies for votes getting stuck in the middle, but I want to start with the folks back home. So families and employers keep asking us the same question. Why does healthcare cost so much, and why is the system so stinking hard to navigate? Now, if you can't explain the bill, you can't defend the system. And if you look at the facts, it really presents as this. Between 2021 and 2024, median launch prices for new drugs more than doubled. And in a single year, over 1,000 existing drugs saw price increases averaging more than 30%. That is far above inflation. Now, patients didn't see their paychecks double. Workers did not see their premiums fall. And so what we have right now looks a lot less like healthcare and a lot more like sick care, a system that is waiting for people to be in crisis before it acts. This is a maintenance rather than prevention system. And as we all know, particularly you all before us today, know that crisis is more expensive than prevention. When a patient is handed a bill that they don't understand, they don't care which entity in the supply chain is responsible, they just know that they're paying more. And so costs being layered across manufacturing, distribution, and contracts are something that patients never see. When prices rise and revenues grow, families still struggle, and people begin to question whether the system is prioritizing patients or profits. So we should be able to do two things at once. We should give companies the certainty that they need to invest and innovate here in the United States, but we also need to be delivering real, tangible, visible savings and affordability and accessibility to patients. So I think that this discussion is very timely. I'm going to start with you, Mr. Davis. 3 companies control the majority of drug distribution in the United States, and many are vertically integrated to control each phase in the prescription drug chain supply chain, from manufacturer to pharmacy. Does consolidating the prescription drug industry lower prices for patients, yes or no?
I'm sorry, does the consolidation lower the prices?
Correct.
It has the potential to, yes.
Okay, so respectfully, your own industry report projects that the big 3 will generate $871 billion with a B in revenue just this year. And that's after 4 straight years of double-digit growth. So if this is potentially saving patients money, why are your revenues growing so fast, and where are patients seeing the savings?
So thank you for the question. I would say there was a couple aspects to your question. One, we're the only sector in distribution that I'm aware of where our cost of goods sold, the amount that we actually sell downstream for, is more money than the more revenue that we get. Right? So it's an unusual one where we're actually in a position that we are actually selling a product for less than we're purchasing it for from from a manufacturer. Manufacturers set the list price.
Okay, but let's get back to the patients, because this is ultimately about patients, right? So if your industry has spent $16 billion acquiring physician management companies, basically buying doctors, right? Where's the savings for the patients?
So in the ability to have the doctor treat, we're not buying physician practices. With respect, what we're doing is we're purchasing organizations that are providing the business support to physician practices in places like oncology and gastroenterology, and in eye care as well. And these are, again, 3 of our 36 members that are in this diversified business area. But one of the things that we hear from those provider groups when they're actually partnering, and in certain instances they are being purchased by the wholesaler, and others the wholesaler is either a majority or minority investor. They're not the complete owner of the vertically integrated MSO, as they're called, management services organizations. But to be clear, they are not purchasing the physician practice.
Well, and my time is running short, so I have a whole litany of questions that I'm going to submit in writing for the record for you. Right now I want to jump to Mr. Gelfand. Did I say that right? My apologies if I botched that. You represent the employers who sponsor the health coverage for millions of workers, the lion's share of those that are covered and insured. So when distribution gets more concentrated, in your opinion, do premiums go up or down for workers?
And we've heard the story before. It took place when private equity started to buy up physician groups.
Kind of what Mr. Davis was just talking about?
It led to the surprise billing crisis that Congress had to ultimately intervene.
So who, in the end, with my remaining 15 seconds, who captures the quote-unquote savings from all of this consolidation?
It does not appear to be working families.
Thank you for driving that point home. I know my time has expired. I have a number of questions I'll submit for the record. Thank you, Mr. Chairman. I yield.